So if you're having difficulty moving your hips when you run, maybe it's causing some knee issues or maybe some foot and ankle issues, and you're trying some strength training movements, but they're just not making the biggest hit, then maybe the reason is you're just not moving your hips well. And one of the ways that you can improve the way that you move your hips is by using a foam roller. So I'm here to show you 3 different ways you can roll your hips and your pelvis to get those hips moving better to improve your running. So get ready and grab your roller and join me. So a little bit of honest talk here. The research is not great with regards to foam rolling, but one of the reasons why is I think people just do it and they can't tell whether they're making a difference. So before you even grab your foam roller and start rolling on it, you want to check to see how you're moving and then retest it later to see if you've had a difference. When it comes to rolling your hips, one of the key movements I like to do is testing your lunge movement. So simply just step forward with your leg. I'm going to roll my right side because that's always a side that is an issue for me, and start moving in a forward and backward motion just to see if it's moving well, like if you're feeling off balance or if there's any discomfort. And then you want to switch and then get that leg on the back and try that same motion. And that's usually where I feel the most limitation is in that movement, right? So once you feel like, okay, that just feels kind of off, and you always want to compare it to the other side. So if I do it on my left side, stepping forward, the left side feels smooth, so does the right side. But when I put that left foot back, I don't feel any limitation at all. That's the biggest thing that I feel. I feel like this hip doesn't move well. When it's in the back, it just feels kind of stuck. So now that you know where you're feeling it, grab your foam roller and let's see how we can improve that motion. All right, so you can use pretty much any foam roller that you have. I have a medium firm one here, and it has some of the knobs on it, but you can use any foam roller, all right? This is the one that I just have here available to me. And we're gonna roll our pelvis first. And so you're gonna sit down on the roller, right on the outer part of your pelvis and just slightly to the side. And then your leg, you wanna keep it somewhat straight, but your knee slightly bent, and then you can use the opposite hand just to give you some body weight support. And it's a small area. I'm just gonna roll about a 2 to 3 inch area up and down. And I just like to do it 3 to 5 times. So if you're having any pain or discomfort, you can slow it down, or you can move to another spot and come right back to that. So right now it's not moving too badly. It doesn't hurt that much, but it does feel a little stuck. So once I feel like I've done that 3 to 5 times, I'm going to hold it still. And then what I'm simply going to do is just do what's called like a pelvic tilt. So if you know cat-cow, when you do a cat position, you round your back and then tilt your pelvis down to the floor. And then you arch your back like you're pushing your belly button and your chest forward. And what you're doing here is trying to get the pelvis to move. It's not an easy motion, so don't try to do too much. You're just seeing if I can get your pelvis to move forward and back, right? If you're having difficulty with that, then check out another video that I have to improve that motion for you. But for right now, just give it a try. And then once you do that 3 to 5 times, you can go down to another spot a little bit lower on the pelvis and do the same thing going up and down 3 to 5 times. The only part you don't want to roll is where the hip joint starts. It's a big bony part that sticks out on the side, and you can roll on it, but it's not very comfortable and it's not very effective anyway. So about 2 to 3 spots along the outer part of your pelvis, and then get that moving. So after you roll the top part of your pelvis, you can scroll down just a little bit and then do about halfway down, and again 3 to 5 rolls. And then after the 5th one, you hold it still. And then again, you try that pelvic tilt where you pull your belly button in and tuck your pelvis back, and then push your belly button forward and tuck your pelvis forward. And you do that 3 to 5 times. And you're trying to use the muscle that you just rolled to see if you can get it moving. I think that's the missing thing too, is that people just roll just like they just stretch, and then you got to use that muscle in a way that gets it used to that knee motion. So that's the one, that's the pelvis. The next area that you're going to roll is your outer hip. So you actually don't want to roll the outer part of your thigh. It's mostly connective tissue, and again, doesn't get good blood flow, but you can roll the outer back of your hip. And what I find is that area gets stuck in people, especially if you turn to roll your leg to the outside or turn your foot to the outside, and loosening that up can also improve your motion. So this time you're going to sit on the roller again, but just below the hip joint. So come down, so you're just below the hip joint, and then you're going to turn your leg slightly to the outside. So instead of being up here, now we're below the hip joint, so similar position. And then again, just roll 3 to 5 times. Ooh, mine's a little tender. Did a little bike ride yesterday and I could feel it. So this area gets affected too, not just with running, but with walking, with cycling, a lot of things. And then hold it still. Now the motion here, come down and rest your arms. You're going to slide your leg to the outside and back. In this motion, if these tissues get stuck, it's really challenging to move the leg to the outside without moving your hip up and your pelvis up. So you want to be able to feel like you can slide it to the outside nice and smooth. And then again, you can do anywhere along the leg, just stay away from the hip bone and stay away from the knee. So then you can go halfway down, turn the outside again, do about 3 to 5 rolls. This one not as uncomfortable, so that's a benefit too. But again, if this area gets stuck, you might start to feel something closer to your knee. Hey, you ever heard of IT band issue? A lot of times people try to stretch it, but this helps to relieve the tissues that can cause that tension. And then come down, and then again, you just, now if you can kind of see me, my leg's moving a lot more smoothly, and all I've done is just bring some blood flow to those tissues. Now here's the other aha. That same muscle that you rolled earlier, you're gonna use that muscle to move the leg up and down, and that may help you with your foam rolling as well. Okay, so for this thigh, the back of the thigh, 3 to 5 times in 2 to 3 areas, avoiding the hip joint, avoiding the knee joint, and then in between you stop and you slide that leg in and out. Should be nice and smooth. So we did the pelvis, we did the outer hip, and we got one more area to go. The next area that gets avoided or kind of missed is your inner thigh. And when we turn our leg to the outside, those muscles get, for lack of a better way to put it, they get ignored and they feel tight, but really they're just not being used. So your body goes, well, we're not going to use those muscles. So we're going to start to use them. So if it feels uncomfortable, totally normal, just take it easy. So you're going to actually lay on the opposite side, and that leg you're rolling is going to be on top. So come down onto your side, bring the top leg in front, and then you're going to put the roller, so it's, the fancy phrase is perpendicular, but at a 90-degree angle, making like a T with your leg. And you can start down just above your knee. Again, avoid your knee. And again, 3 to 5 rolls, so something simple. And you can decide how much pressure. If it's really sensitive, then you come up a little bit and you don't put as much weight on the roller. If you can tolerate, you come down and you push down gently on the roller, and then you rest it. And then the motion we're doing here is actually, the fancy phrase is internal rotation. You're going to twist it in, but the key is removing that hip. So the pelvis stays straight, the hip stays pointing straight upwards, and then you're going to rotate that knee inward. But the key is you're not turning the knee, you're turning the hip joint. It's a tough one, I totally promise you. And right now, it's actually a little bit sensitive, so I'm not going to be forcing it as much. And then come back down. And then you go halfway down again, roll 3 to 5 times. This one's a little bit more sensitive for me, so I'm not going to be as aggressive. And then hold it still. Notice I'm just doing a small area, like a 2 to 3 inch area, maybe 4 if it feels good. Hold it still again. Put my finger on the hip joint to make sure that's where I'm moving. And then again, rotate that whole leg in, pointing the knee down. And then rest, all right? And then you can go high up on the inner thigh and do that same thing, all right? So those are the 3 key areas you're gonna roll: the pelvis, the outer back part of your hip, and the inner hip, all right? Give those a try, and then when you're done, let's stand up and retest it. All right, so we just got done rolling, and we wanna go back and retest those lunge motions to see if we have any improvement, if it feels better, or likely, not likely, but it might actually, it could make it worse. And we want to see if that's the case, then reach out to me. See if you have any questions. So let's step forward first with the leg you just rolled, and then go forward and back. And the biggest thing that I feel right away is that my whole hip just feels like it's moving a lot more smoothly forward and back. All right? And then the next thing you want is that leg go back. So step forward with the opposite leg, and then again the same thing. Now, the biggest difference that I feel is that when I go forward, I feel like I can keep going and not like this part of my hip is keeping me stuck. And all we did, again, is roll the outer part of your pelvis, the outer back part of your thigh, and the inner thigh of your leg. So that's it. I know it's not simple, but it can be effective. And the key thing is, if you feel overwhelmed, just pick one thing. Make sure you definitely do that testing before and after, and pick one of those movements that you're going to improve, and then let me know how you do. If you have any questions, please comment in the section below, or if you want, you can reach out via my website, and that's also in the description as well. Good luck with that, and let's keep you running on the trails and roads.